Okay, this is video number 7 of Diaries of a Coronavirologist. Today is the 25th of March and we are up to about 468,000 cases and a little bit over 21,000 deaths confirmed of COVID-19. So to stick with the little diaries aspect of the title of this channel, a little bit of news from the lab is we submitted a bioarchive paper today. It's my first experience of doing a bioarchive paper, so that was fun. For those who are unfamiliar with bioarchive, I just want to give a little mention to what it is and a little word of warning if you look at anything there, or medRxiv, similar concept. So these are preprint servers. They're a good way to get data out fast, but they aren't peer reviewed. So normally science goes through rigorous peer review, whereby you submit your data and your manuscript to a journal to publish it and have it available for everyone to look at. And it's assessed by 2 to 3 scientific peers, so experts in your field, for whether you've performed the experiments well, whether you thought of all the appropriate controls, or whether your data truly supports your conclusions. So once it's assessed, you can do new experiments, you can improve what you've already done if necessary, and then hopefully get it submitted and out for everyone to see. bioRxiv is different in that you can just submit data and a paper and it will be published in apparently about 48 hours based on the emails I received today. So this means that potentially bad science can be published, or science lacking controls, or not performed well, so it has to be assessed with a very critical eye when looking at bioRxiv. But the benefit it has is you can publish things very quickly. So we've been doing work with drugs that might inhibit SARS coronavirus, and we want to get that out into the public sphere so people can see it. Moreover, if lots of different labs around the world are doing similar things, which they are, then if they hit the same results, this is a nice way to independently verify research and give us more confidence in what everyone is seeing. So whenever that makes it up onto the bioRxiv site, I'll put a link somewhere in one of my videos so people can have a look at the research we're doing if you are so inclined. But for today's topic, I want to talk about seasonality. So in my video yesterday, I was talking about the idea that I want to do a little look back at where this virus came from and how we got to this point. Today I want to do a little look forward and think about the potential of seasonality. And then tomorrow or Friday, whenever I do the video, I want to look at the present and talk about how SARS coronavirus 2 is causing COVID-19. But for today, the topic is seasonality. So to answer the question about seasonality very quickly is right now we don't know. It's too soon to tell for the SARS2 coronavirus. To look at some other viruses though, we do see seasonality with influenza. In the Northern Hemisphere, flu season is between about October and April, March, May, those kind of months. And the virus does seem to be impacted by the changing environmental conditions. So it's been found that flu does not transmit so well when it is cold and dry like it is in the winter. Moreover, during the summer months, there is a higher level of UV radiation because the sun is closer. And UV light is very good at destroying viruses at the right dose. So it causes mutations to genetic material, that's how it causes skin cancer, but it can also degrade viruses and make them non-infectious. So these are the kind of things that can influence a virus's ability to spread in summer months, and that seems to be the case for influenza. But with coronaviruses, it's a bit less clear, and we're unsure about this virus especially. As I talked about in an earlier video, there are 7 coronaviruses that infect humans, and 4 of those do appear to show seasonality. They cause common colds in the winter months. Now, whether this is totally down to changing environmental conditions or the immune state of the people who become infected, meaning that there's fewer people to be infected in the summer because they're infected in the winter, is a little bit unclear. But let's have a little think about the more pathogenic coronaviruses. So SARS-1, the original SARS that spread between November and July, we don't know if that was seasonal. We have no evidence to suggest that it's seasonal because it didn't go through a full cycle. Some may argue that because we stopped seeing SARS in the summer months, that it was sensitive to the changing environmental conditions. However, it's much more likely that it was the public health interventions that completely blocked SARS spreading. And I'm lining up a video for a few down the line talking about why it was easier, seemingly, to contain SARS-1 than it is being to contain SARS-2. And it does come down to the public health response and the way the symptoms develop. Then if we look at MERS, this virus has largely been confined to the Middle East, with the majority of cases being in Saudi Arabia, and generally the Arabian Peninsula. And there it's pretty warm most of the time. So we don't really see any evidence of seasonality. There's sporadic cases of MERS all year round, depending on when people come into contact with camels that are the reservoir host of the virus. So with those viruses, we don't really necessarily see seasonality, but with the low pathogenicity coronaviruses, the endemic coronaviruses, we seem to see seasonality. So that brings me to SARS2. And right now it's just too early to tell. Currently in the Northern Hemisphere, we have been in winter months. We're just slowly coming out of them now that it's March and April coming up soon. And most cases have been in the Northern Hemisphere, so maybe that suggests there is seasonality. But we are seeing cases in warmer climates and seeing spread in the Southern Hemisphere, so maybe that suggests there won't be seasonality. And it's hard to know from precedents with the other coronaviruses whether these viruses are really sensitive to the changing environmental conditions. There are more and more models, though, coming out from epidemiologists suggesting that there will be waves of this virus. So seasonal, cyclical outbreaks. So we may end up in a situation where indeed there is a drop in cases come the summer months and a resurgence in cases come next winter for, again, the Northern Hemisphere. But this may not be down to the virus being affected by the changing weather conditions. It might be more about the changing population. So as more and more people become infected with the virus, more and more people become immune. And this does seem to be a developing trend, that people who are infected do appear to be not getting reinfected. And this has led to the idea of using convalescent sera as a potential treatment. So convalescent sera was something used in Ebola outbreaks in the past, where someone who has survived the infection develops antibodies that can be transferred to another person, and they can potentially be therapeutic. So immunity and the use of convalescent sera is going to be the topic of another video in a couple of days' time, depending when I get to the video, but it's really high on my list because a lot of people have been asking about immunity and chances of reinfection. But in terms of seasonality, the potential for immunity may mean that there are fewer people who can become infected in the summer months, so we see a lull in cases, but that immunity may not be very long-lived. We currently don't know, but if it only lasts for about a year or so, we may see a resurgence in cases. Similarly, all of the social distancing measures we're suffering may be or are going to be beneficial, so we may see a drop in cases, flattening the curve, and that would coincide with summer. Now, whether that means there's true seasonality, that's a philosophical question, I guess, but it does look like the models are suggesting we will have to deal with this virus again. So if we're stuck with this virus, seasonality or this cyclical nature of outbreaks may actually be good, as I say, if we're stuck with it, because it gives us time to prepare. If we are expecting it to come back, we can get ourselves ready. We have more time to look for antivirals, we have more time to test them, we have more time to test vaccines. So we can get ourselves ready and maybe not suffer as badly as we are currently from this outbreak, and hopefully not drop the ball on being prepared for it. And to flip it to the Southern Hemisphere, if it does show seasonality and there starts to be an increase in cases in their winter, or your winter, depending where you're watching, then at least they can be getting prepared now and learning from what's working and what isn't in the response in countries that are being the hardest hit. So that's seasonality, and what I want to say today on that topic. It was one that people have asked me about before and one I've talked to a few reporters about in the past, so I thought I'd tackle on the channel. Tomorrow I'm going to be talking more about the disease, and then I think I'll be talking about immunity after that. So please remember to subscribe to the channel so you get the updates when I post the videos, and please keep tuning in and sharing them if you're enjoying them. So with that, thank you for watching. Stay safe, wash your hands, stop panic buying toilet paper and everything else, and keep calm and carry on. We are going to get through this pandemic and these crazy times we live in.